Europe appears to be the epicenter of the COVID-19 pandemic once again. According to the WHO, 53 countries in the region hit a new weekly high for confirmed cases, recording over 1.5 million last week and more than 10 million since the start of the pandemic. It's a medical crisis and hospitals are nearing breaking point, with hospitalization reaching levels unseen since the spring and deaths soaring by more than 30% in the last week of October. A number of countries are reintroducing national lockdowns, but can they reverse the trend? For this, we connect today with France and Germany correspondents for the Wall Street Journal, Matthew Dalton in Paris and Bojan Panchevsky, who's joining us from Berlin. Thank you both so much for coming on the show. We know it's a terribly inconvenient hour over there, so we really appreciate it. And well, my first question to you, Matthew. Now, 65 million people in France, they entered a second lockdown on Friday as daily infections continue to surge. And over the next month, people will have to stay within a 1 kilometre range of their homes, save for going to school or the supermarket. And all non-essential businesses are closed, and people are, of course, required to work from home if possible. So how have people been responding to the lockdown so far?
There's been a lot of anger, a lot of frustration, I think. A lot of businesses that are being forced to shut down again after being forced to do so in the spring. Small businesses that are in more precarious financial situation. Those kinds of entities are not happy. They've been complaining to the government. They've been demanding to know if, in fact, the measures can be relaxed come November 15th or even sooner, before the full month of lockdown, which the government has said will happen. In the spring, people went into this, I think the entire country went into it with much more sort of willing and understanding attitude, and now people are more upset.
And well, Matthew, why do you think infection numbers have been soaring so much over the past couple of weeks in France? And do you think the second lockdown is going to be effective?
It's unclear why exactly the cases have been rising so quickly. People have been wearing masks everywhere, which is supposed to prevent infections. However, there are a lot of environments where you're allowed to take off your masks and to be in a sort of public setting and an enclosed setting, for example, in restaurants, cafes, where once you're at your table, you're allowed to take off your mask and eat and drink. And it's probable that those are the kinds of environments where cases have really been spreading. And the fact that the weather has gotten colder has meant that people are inside in those environments more often. However, the last 2 days, cases, the 7-day average of new cases has fallen for the first time since the beginning of October. So it's possible that we could have reached a peak, and now as the new measures kick in, there was a 9 p.m. curfew that went into effect a few weeks ago. So that has presumably slowed transmission somewhat, and maybe we're seeing the effects of that now in the falling new case numbers. And, you know, if everybody's hoping that sort of momentum, downward momentum, can continue.
So France is going into a second national lockdown there, and a growing number of countries in Europe, including England, Boris Johnson announcing that England will go into lockdown again, possibly for a month, maybe even more. And of course, in Germany, lockdown light, as they call it, will begin Monday for 4 weeks in a bid to curb the spread of the virus. And Bojan, now during this period, restaurants, bars, sports and cultural venues are going to be shuttered, and there are going to be limits to public and private gatherings, of course. But then at the same time, the restrictions, they still allow schools to remain open as well as nursing homes. Do you think, with those allowances, do you think the lockdown will be effective? And how are people in Germany generally responding to these new measures?
Yeah, it remains to be seen how effective the lockdown will be, but basically the aim is to reduce public life to a minimum, and therefore all the avenues where people might gather and interact are being sort of shut down. Schools, as you said, and kindergartens and daycare centers will remain open, unlike during the first lockdown because there has been empirical evidence that the schools and the kindergartens are not driving this pandemic, at least not the elementary schools. That means children up to the age of around 12 don't seem to be sort of spreading the infection. As to whether it will work, it has to work, because I think obviously contacts between people will be reduced, and that's what's sort of causing the spike in cases. And the less contacts you have, the less infection. Whether or not that's sustainable, that's obviously a different question, because you ask how people are taking it here, and I think similarly, like in France, they are a bit fed up. Obviously, France had a stricter first lockdown, and the second lockdown is much stricter as well. In Germany here, we've never really had a really strict lockdown. But people are, however, asking, is the plan of the government midterm or long term? How is this pandemic going to be handled if every time cases go up, there will be a need for a lockdown? And I think nobody really has an answer to that question. Everyone hoping that they will be able to, subdue curb the spread of the virus and keep it at a low level, which will be manageable for the healthcare system.
Well, small business owners have definitely seem very upset by these new measures, and we've seen a lot of resistance in Germany and other countries as well. And well, Matthew, lockdowns, of course, in Paris as well, in France as well, they inevitably affect the local economy, those independent shops that you see, dotted in the streets. And a lot of small shop owners have been worried that they'll lose business to the likes of Amazon and other online retailers. Is the government doing enough to protect small businesses and secure people's livelihoods?
Well, in response to complaints from a lot of small businesses, the government said that they're going to forbid the big box retailers that sell essential and non-essential goods from selling non-essential goods. So the small business people were complaining that because big box stores do sell both of those things, that they're allowed to stay open and thus can sell the non-essential stuff as well. And they were saying that we're gonna lose lots of business to all to those kinds of stores, the small business owners that sell non-essential stuff. So the government has said the big box guys are not going to be able to sell non-essential stuff. And however, that doesn't really stop Amazon from operating in France. Earlier on in the pandemic, Amazon had to close a number of its warehouses because workers were upset that they were also selling non-essential things. And Amazon adapted to this by shipping goods to people in France from warehouses that are not in France. And, it's a huge company, global presence, footprint throughout Europe. So I think they'll probably find a way to sell things to people in France. You could argue that potentially this is, again, cementing or giving kind of market share to Amazon at the expense of other, big companies in France that compete with Amazon.
Well, Boyan, the number of people in intensive care units in Germany has shot up, and authorities, they also seem to have lost control of testing and contact tracing. And in 75% of the cases, I think your chancellor said that the source of infection is unknown. What do you think has led to this massive spike in numbers, and how have authorities been adopting new testing methods and responses you've been reporting about?
Yes, well, basically, I think for the whole of Europe, it's true that in summer we've had a sort of return to normalcy. A decision was made at a European Union level. The European is the union, the political and economic union of the 27 member states, of which Germany is the largest one. And a decision was made to basically open up for tourism in June, July, August, September, and people started moving, and obviously the virus started circulating, and then we've seen numbers slowly shoot up from then, and we've reached this level. So essentially, many sort of events that were banned during the first lockdown were then allowed, and then you had big gatherings of people, over 1,000 people, for example. You had cultural venues, you had party venues, especially here in Berlin, and that inevitably will lead to an increase in cases, and it has happened. As for testing, I mean, the testing and tracing obviously breaks down after a certain benchmark. And as you said, 75% of the cases cannot be traced anymore. The origin of the infection is unknown. And therefore, the government decided to shut down the places that sort of scientists assume are the origin of the infection, although they don't really have an evidence for that. Testing can be scaled up a little bit more in Germany, but it is reaching its capacity. The country, although it has a huge diagnostic industry, perhaps the biggest in Europe at the moment, to try and sort of alleviate that, they've introduced now, sort of late in the day, but they did it anyway, the so-called antigen tests, which provide a result within 5 minutes, sometimes even quicker. So that is a hope they are now being applied at nursing homes where the elderly are being cared for. And the idea is to allow for visits. So when they shut down everything, not to sort of isolate the most vulnerable, but to have these instant tests that can be applied at the entrance so people can visit their loved ones. However, that's also not a durable plan, so I think they are thinking of expanding that particular way of testing to the broader society, and that would require purchasing many more millions of these tests.
And Boyan, you reported that Germany is aiming to start vaccinations this year. Have there been any promising developments on this, and how are authorities preparing to actually manufacture and distribute the drug at such a massive scale?
Yes, well, the authorities are not obviously manufacturing the vaccine. It's the vaccine makers who are doing that. And Germany is fortunate to have one of the front-runner companies. It's called BioNTech. It's based in the city of Mainz. And it's one of the 3 or 4 companies that are likely to start submitting their vaccines for authorization by the regulators in Europe and in the United States as well. So the government here is sort of preparing the logistics for that. They've decided there will be around 16 vaccination centers. These centers will probably be large venues such as sort of sports halls or big sort of trade halls or whatever, where you can get a number of people, where you can put in the special equipment required to store these vaccines. They need to be stored at a very low temperature. And that is being set in motion at the moment. But however, nobody knows what will happen with the authorization. This particular company, BioNTech, is working with the American pharma giant Pfizer. And their estimate is that they would be able to submit their vaccine for approval at the end of November. And then we will see how quickly the regulators will decide whether to allow that vaccine on the market. If that happens, then in Germany, it could happen that within hours, the doses of vaccines, which are already being manufactured, so the manufacturers, not just these companies, but also all of the companies, I think, they are in the run for submitting vaccines to approval, they're already manufacturing at risk. So millions of doses are being produced and stored as we speak across the West, and it would be fairly quickly, presumably, to start delivering them. But however, it's also very important to know that there won't be enough vaccines for everyone. So essentially, they will prioritize the use of the vaccine, and the first groups to get them will be people working in healthcare at the front line, in hospitals, nurses and doctors, and then the vulnerable, presumably the elderly or people who have critical conditions.
Right, so we really need to get those supplies out to the medical workers first. And well, now, Matthew, there were many reports in terms of addressing this pandemic. There were many reports of growing division between countries of the European Union earlier this year during the first wave of the pandemic over issues such as securing medical supplies and border control. But recently, EU leaders, they pledged to cooperate on the latest lockdowns, and they set aside $257 million to enable the transfer of COVID patients across borders, which would ideally help prevent healthcare systems from being overwhelmed. How are France's hospitals and medical workers dealing with the second wave right now? And are you optimistic about this pan-European plan building solidarity during this pandemic?
Well, during the first wave, there was also solidarity. Actually, in France was one of the main benefactors. Several hundred patients were transferred from from the east of France, which is one of the hardest hit areas in Europe, to hospitals in Germany and Austria, as well as Luxembourg, and so it was significant European solidarity for France in those situations. I think you could definitely imagine that kind of solidarity could be needed again. And the problem this time around is it seems like all of the countries seem to be dealing with this broad increase in cases and broad rise in the burden on hospitals. I mean, what France did also, aside from transferring patients to other European countries, is also transfer patients around the country to hospitals in areas that were much less hard hit. The main areas that were hit in the first wave were in the east and Paris, and so the patients were transferred hundreds of miles to the far west, to the south, and that really helped France cope with the surge in patients. This time, it seems like the increase is more broad-based, and French officials have been saying that the second wave could be worse than the first wave in terms of the impact on the hospital system and then life support units, intensive care units. So France has been, like a lot of countries, increasing its capacity in those areas. And there's still significant capacity left. And if the pandemic cases are peaking right now, hopefully, then France should be okay. But if cases continue to go up and the beds keep on filling up, I mean, to keep in mind that cases are a sort of leading indicator, and then hospitalizations follow, a week later. So we still don't know how bad it could get in France in terms of hospitalizations and people flooding the ICUs.
Well, the increasing number of hospitalization across Europe has been really concerning, and it really underscores the need for national lockdowns to be in place. And well, this is where we'll have to wrap up our discussion for today. Thank you both for joining us. That was Matthew Dalton, France correspondent for The Wall Street Journal, and Bojan Pančevski, The Wall Street Journal's Germany correspondent. Again, thank you both so much for your time.
Thanks for having us.
Thanks a lot.
This is also where we end the programme. Thank you for watching.